Hi, my name is Manoj Sharma from Allscripts Healthcare, and I want to welcome you to the Mother and Infant Mortality Prevention use case here at HIMSS 2019. In our use case, Jada Quinn, a 34-year-old Native American female who is currently in her 36th week of her second pregnancy, arrives at her OBGYN office at the Women's Center in downtown Salt Lake City, Utah. Upon intake, the nurse has documented some of her vitals, including documenting her elevated blood pressure. In addition, upon examination by her doctor, she has edema or swelling of the face and hands. As you can see here in the problem list, there's the diagnosis of hypertension based on the elevated blood pressure and the edema. In the latest TouchWorks 18.1 EHR product, the installation or the client can actually configure CDS hooks within various parts of their workflow. Those cards that come back from the CDS hooks execution can be displayed here in the ribbon at the top, as well as in the clinical assistant that is alerted also up on the top ribbon. You'll see some of the cards are actually returned on the right side here as well. Some of these provide evidence-based recommendations, suggestions, and actions, including Smart on Fire launches within the workflow. In the card up here, you'll see that we actually get back a card from Motive Care.
Thank you, Manoj. I'm Kelly from Motive Medical Intelligence. Motive provides computable clinical knowledge that integrates with systems like Allscripts TouchWorks to provide real-time patient-specific guidance at the point of care. And in this particular case, for Jada, our use case patient, Motive Care CDS, running against her available patient data, has identified that Jada is a pregnant woman showing signs and symptoms of preeclampsia with a gestational age greater than 20 weeks. And the signs and symptoms that she's showing include elevated blood pressure, nausea, vomiting, and because of that, Motive Care CDS has recommended both a diagnostic workup and admission to labor and delivery for Jada. An important thing to note is that all of the actions and insights from Motive Care CDS are evidence-based, and in this particular case, the actions recommended for Jada are based on evidence from the American College of Obstetricians and Gynecologists Task Force on Hypertension and Pregnancy. This is a more technical view into how the knowledge is made interoperable and shared across systems. You see the CQL FHIR, which is part of the HL7 standards. That's how it's all done. The clinical logic, the algorithm, the criteria that works on the patient data to produce and recommend the actions is encoded as CQL and FHIR. The actions that are returned are encoded as FHIR. And a third standard, CDS hooks, is used to integrate across systems between, in this case, Allscripts TouchWorks and Motive Care CDS. In this demo, Allscripts TouchWorks is sending two CDS hooks requests to Motive with Jada's patient data as FHIR resources, and Motive Care CDS is sending back the actions as CDS hooks responses that then can integrate within the Allscripts TouchWorks system and within the physician's native workflow.
Thank you, Kelly. So those cards come back as evidence-based recommendations or suggestions within the workflow. So the guidelines for Jada around hypertension and pregnancy, as you can see, can be readily available to the provider to review those informations to what is relevant to that card. In addition, as I mentioned earlier, the Smart on Fire launch for other decision support to help drive to get better care for Jada. So in our use case, we have a card that says that the patient has signs or symptoms of preeclampsia. So what we want to do is refer Jada to the birthing center for further care. The birthing center utilizes Epic, so what we'll do is actually send over an XDR direct message of her CCDA summary of care. So let's go ahead and get that started and refer her, Jada, over to the next step.
Hi, I'm Kelsey with Epic. Jada has now been admitted to the hospital, so we can look at her chart. We can see directly that we've received the problems and medications from the Allscripts clinic, which we can directly reconcile into her chart. Her care plan is to maintain her pregnancy until the baby is more mature. 2 days after Jada is admitted, she is diagnosed with chorioamnionitis and she is induced into labor. We can send the admission information via HL7 to OBIX for electronic fetal monitoring.
Hi, I'm Ann with OBIX. Jada is admitted into the OBIX system via an ADT message from Epic, and once the message arrives, she is bedded in room 402, and the nurse is going to apply the fetal monitors, and you will now start seeing the fetal heart rate tracing, the maternal heart rate tracing, as well as the contraction pattern. We also notice on our central station that we have all the other patients present in our unit that are displaying, so we can keep an eye on everybody in one location. We can also see that there are fetal alerts that are presenting to us for fetal tracings that may have an issue or cause for concern at this period of time. Since we see that Jada has been placed on the monitor, we can go and review her tracing. Now we notice that her information is presenting as well as the user is logged in. This came from a single sign-on within Epic. We can display her tracing, which is longitudinal from the time she was admitted to the hospital until the time that she is discharged, whether that's baby in belly or baby in arms. As we look across this tracing, we see that some vital signs are presenting from the fetal monitor. These vital signs were taken by the fetal monitor. They pass into the Epic flow sheet where they are then validated by the nurse. Once validated within Epic, they post back onto the OBIX tracing. This allows us to maintain a single source of truth patient record, along with having a synchronous record that allows for deletions and modifications that happen within Epic to happen simultaneously within OBIX.
Hello, I'm Kurt with HIMSS Medical. While in labor, Jada receives an infusion with the CAD Solus infusion pump for epidural pain management. HIMSS implements integrating the healthcare enterprise patient care device profiles to communicate with other systems in the hospital. HIMSS receives detailed pump location information via the IHE PCD medical equipment management location profile from GUARD RFID. During the infusion, her pump detects an occlusion alarm, which is reported along with the pump's location provided by GUARD RFID to the Cerner Alarm Manager using the IHE Alert Management Profile. Cerner sends the alarm notification to Volt using the same profile, where it is displayed on the nurse's smartphone. And I'll hand it over to Epic or Cerner to explain more.
Thanks, Kurt. So this health system is using Cerner's CareAware system for device connectivity and alarm management. In this capacity, as seen here, the CareAware system performs continuous observations of any connected device. In this case, it's the HIMSS pump device. Switching over from a device connectivity to an alarm management capacity, this demonstrates from a middleware perspective the ability to consume the alert from the HIMSS medical device, discern through standards, through the metadata that's transferred, the priority of that alarm event, route that to endpoint devices such as Volt's smartphone to ensure visibility of the incident at hand. So once that occlusion has been addressed, because we were able through standards to consume and report that event to the smartphone device, the patient is stabilized, and we're going to continue monitoring.
We are continuing in the labor progress with Jada. We can see that we have her fetal heart rate tracing presenting across the top, as well as her contraction problem or pattern. And I, as the nurse, start to notice that there are some concerning features of the fetal heart rate pattern and contraction pattern. So I'm going to use tools embedded within OBIX to help standardize my assessment. I can choose to use things like a variability tool that will tell me the fluctuations in the fetal heart rate. I can also look at things like decelerations that might let us know whether Jada is having problems with oxygenation during her labor. We also notice that her contraction pattern seems quite excessive, so we can allow the OBIX uterine activity tool to help us with the assessment of that tracing. We notice that the computer has assessed, marked all of the contractions that it has found with a start, peak, and an end. I can calculate critical values like Montevideo units, and once I do make that confirmation, it allows me to have all of my values auto-computed for me, and it's going to give me a clinical decision support alert letting me know that I need to take a closer look at my tracing. As we continue to look across Jada's tracing, we will notice that indeed her fetal heart rate continues to decompensate, and this leads the clinicians to the decision to make an emergency cesarean section delivery for Jada. The baby is delivered and transported to the NICU for further care.
Now that the baby has been born, we can view her chart in Epic. While baby Jenna is in the NICU, she receives IV antibiotics from the Smith's infusion pump.
So Smiths provides pump usage data to guard RFID using the IHE infusion pump event communication profile as events occur. So when newborn Jenna needs to receive an antibiotic infusion, Guard RFID system can be used to locate an infusion pump that is not already in use. The pumps not in use are shown in green and then can be located on the map. So now that we've located an available pump, we are ready to administer the medication using smart pump programming. We scan the medication. And then we scan the pump. And the infusion parameters are automatically sent from the Epic system to the Smiths Medical Infusion Management System via the IHE point of care infusion verification profile. The nurse confirms the parameters on the pump screen and starts the infusion. And Smiths then sends the infusion data to Epic, Cerner, and Guard RFID using the IHE profiles.
Both the mom and the baby are treated for infection during labor and delivery and postpartum. Jada's sample is collected at the time chorioamnionitis is diagnosed, and baby Jenna's sample is collected postpartum. The lab results are recorded in Epic and then sent via HL7 to Philips for infection control.
Thank you, Kelsey. Hi, I'm Raja from Philips. Philips IntelliSpace Epidemiology helps the hospital infection control and prevention team to detect a patient's infection, whether it is hospital-acquired infection or outside hospital-acquired infection. This product helps to resolve this investigation through microbiogenetic fingerprinting. In this use case, Jada and her baby girl, both they are in NICU care unit, both they have tested positive for MRSA. Few days earlier, Elena and her baby boy, both they have tested for MRSA. Now the infection control team wanted to start an investigation in this tool. Here you can see the investigation. The Philips IntelliSpace Epidemiology has identified all 4 MRSA patients as a suspected cluster based on their state location and state time. Now the infection control team requests genetic sequencing lab to collect all 4 MRSA samples and upload into the system. Once the genomics file successfully processed by the system, we can see the result here. In left side, we can see the MIC data comparison for all 4 patients. All the drug resistance information is coming from EPIC through HL7 microbiology message. And then right-hand side, we can see the genetic relatedness for the suspected 4 patients. If you see here, Jada and her baby girl, both they are at one cluster. Likewise, Elena and her baby boy, both they are at another cluster. So The Philips IntelliSpace epidemiology shows the evidence clearly. The baby girl's infection is genetically related to her own mother's infection. It is not related to another NICU patients in the care unit. So this helps for infection control team to take a decision. They don't want to close the NICU care unit because this is not a hospital-acquired infection. Thank you.
Hi, I'm Dalibor from Guard RFID. In this hospital, Guard RFID system is used for asset location, asset utilization, and also infant protection. We've seen earlier when the nurse needed a pump to infuse baby Jenna, she was looking in Guard RFID system to find pump that is available and be able to locate where that pump actually is on the floor plan. If you remember, at that time, that pump was showing in green, indicating that the pump is free and currently not in use. Right? Currently, that pump is shown in yellow, what indicates that pump is not available anymore for new patients because it is being used and infusing this patient. Details on that pump card show what medicine is being infused, is the pump running on a battery or main power supply, and similar details. All this information comes from the pump to Guard RFID system, from the Smiths pump to Guard RFID system through HL7 messaging and IHE profiles. Location of the pump was enabled by placing RFID tags like this on a pump, and you can see one of those tags on the side of Smith's pump. Similar tags that are used for location of the pumps and other assets in the hospitals are also used for patients. Tags like this are placed on both mom and the baby at the time when baby Jenna was born. At that time, demographics information about the baby and the mom were sent to Guard RFID system from Epic using ADT messaging. Those tags that are placed on mom and baby are used to prevent mother-baby mismatch. If baby Jenna was given to her mom, the system, when those two tags get close to each other within 12 inches or less, the system will recognize they are close, and because they are linked in Guard RFID system together, system will not raise any alarms. But if the baby Jenna is given to any other mom in the hospital, system will also recognize when they get close together, and the alarm will be raised indicating mother-baby mismatch, and the nurse will be notified instantly. That same tag that is on baby Jenna, and that tag can be seen on baby's ankle, is also used to prevent unauthorized removal of the baby from the hospital or even from baby's room. To demonstrate how it works, I'm going to take the baby now and try to walk away with the baby. After some time, the system will recognize that I'm trying to take the baby away from her room. The alarm is raised in Guard RFID system, indicating exact location of the alarm and information about the patient, in this case, baby Jenna. That same alarm is in real time, as soon as it happens, forwarded to Cerner, which in this hospital is acting as alarm manager, using HL7 messaging, and from the Cerner to Volt, again through HL7 messaging, and from there Volt distributes that to nurses' mobile devices.
Thank you, Dalibor. Hello, ladies and gentlemen. My name is Dustin Lake with Volt, and with it being Valentine's Day, I don't know if you can feel all the love in the air, but I will tell you that doctors and nurses absolutely love our Volt smartphones. Volt is actually an acronym that stands for Voice, Alert, and Text. And when our nurse grabbed her smartphone at the beginning of the shift, not only did she indicate what unit and department she's currently working on, but she also selected which room she's covering as well. In doing so, not only is she able to make and receive phone calls, send and receive HIPAA-compliant secure text messages, but we can also receive alerts from patient monitors directly on the smartphone based on the rooms you're covering and the patients you're currently caring for. In this use case, we actually received two alarms, the first one being delivered as an inclusion alert from the Smiths medical pump. When the nurse received the alert, not only did we get the relevant information about the alarm, but we also received the location of the pump via RFID. In doing so, the nurse can acknowledge the alert, and in doing so, Cerner knows not to escalate that alert to any of my other backup buddies. I can then make my way down to the room where I silence the pump in the room and can start tending to the patient. The second alert we received was a code pink when the baby was removed from a secure area. When the baby was discovered and the Guard RFID tag was fired, that alert was not only sent to the caregiver currently caring for that patient, but we also sent it to every nurse's phone on that unit so they can all be on the lookout.
So after the birth occurs, the birth has to report it to the health department. In this case, it's the Utah Health Department at the Vital Records and Statistics Office. To ease the burden of reporting, we actually have a fire-enabled app that can be launched within the Epic application, as you can see on the left screen. And once it's actually launched, it pre-populates some of the information. So the birth clerk can then look through that data and add any additional information and then send it on to the health department. So once we actually do have that information at the health department, we actually create an HL7 version 2.6 message, as you can see on this screen, that has information about the mom, the race and ethnicity for the mom, the final route and method of delivery, risk factors in the pregnancy, and other information. That information is then sent on to NCHS via FinMS so that they can actually code the race and ethnicity, in this case, American Indian or Alaska Native. Once we do get that information back, we do send it on to other programs within the health department, such as the maternal and infant health program, but we also put it on our indicator-based information system that we call IBIS. And we do have a birth module on IBIS that has many reports about births within the health department, including newborn screening, birth defects, and other indicators.
Good afternoon. I'm with the CDC, and I'm representing the National Center for Health Statistics and our support for the right screen, the eVitals Standards Initiative, which is created to support the development of interoperability between the jurisdiction's EHR systems and the U.S. vital record systems. In our scenario, the Utah Department of Public Health's Vital Records Registration System prepares the HL7 birth report message and sends it to NCHS via CDC's Public Health Information Network. The parsed messages are loaded into our birth data system. Because the multiple race and ethnicity includes literal entries, NCHS provides a coding service to the jurisdictions. Our in-house coding module reviews the provided race and ethnicity content and generates codes useful for analysis. Our system then returns the coded race and ethnicity to the jurisdiction for their use. For our part, at NCHS, we generate analysis tables and reports and post them on our website. In this particular example that I've selected, the table reports characteristics of labor and delivery by age, race, and Hispanic origin of mother. I selected this report to highlight the tabulations of our subject's infection is chromoamnionitis.
Thank you, David. Ladies and gentlemen, I'd like to thank you for joining us on this mother and infant mortality prevention use case. If you have any questions, please stick around. Thank you.